Alright, let's talk about the USPSTF screening guidelines updated for 2023. This video is great for exams like USMLE and COMLEX. We're going to have a full summary at the end, so don't worry about taking notes. And of course, questions and comments are welcomed, and I would love to hear from you. Let's begin with breast cancer screening. So mammography should be performed every 2 years for women 40 to 74. This number used to be 50, but now it's 40. 40 to 74 every 2 years. Now, if she's older than 74, there's no clear data on this, and therefore we're not going to be tested on it because we're only tested on clear data. Cervical cancer screening. So the first pap smear should be done for women at age 21 and not before this. From 21 to 30 every 3 years, and from 30 to 65, co-testing every 5 years can be done. Now, the HPV vaccine should be given to women ages 11 to 45. Chlamydia screening. So chlamydia should be done yearly until 24 years of age in women who are sexually active, and after that, if she's 25 and above, only if there's an increased risk. This is different than gonorrhea, which is only tested ever in patients with an increased risk, even when they're younger than 24. So gonorrhea, only if there's an increased risk. HIV screening. People ages 15 to 65 should be screened for HIV. If they're younger than this or older than this, if they have an increased risk, they should be screened for HIV. Diabetes screening. So we go for adults ages 35 to 70 when they have one of the following conditions. Either the patient is obese, patient has hypertension, or the patient has hyperlipidemia. If they have one of these conditions and they're ages 35 to 70, they should be screened for diabetes. Gestational diabetes, I wrote a note over here, should be screened in pregnancy during weeks 24 to 28. It's generally done during week 26, and if the patient is high risk, we do it during the first visit. Lipid screening. So I wrote the old formulation over here, but according to the strict guidelines, this is the new formulation. It's formulated in terms of statins that in patients ages 40 to 75 who have one or more CVD risk factors and an estimated 10-year risk of a cardiovascular event of 10% or greater, they are given a statin. What does this mean in terms of exams? Well, a patient with a history of stroke, a patient with a history of stable angina, a patient with an LDL greater than 190, and a diabetic patient older than 40, all of these patients need statins. Colon cancer screening. So this is by far the hardest one because there are so many details. Screening for colon cancer every 10 years beginning at age 45 is the new guideline. If there's a family history of colorectal cancer, so if the first degree relative, for example a parent, sibling, or child with colon cancer diagnosed at age less than 60, or two first degree relatives diagnosed at any age, then we begin at age 40 or 10 years younger than the earliest diagnosis in their family, whichever comes first. And then it's not every 10 years, but it's every 5 years. If the patient has a history of colon cancer, we test 1 year later, then 3 years later, then every 5 years indefinitely. And we counsel the patient that siblings and first degree relatives need to be evaluated. If there's a strong family history, for example, we're concerned about Lynch syndrome, then the patient needs to start screening at age 20 to 25. Lung cancer screening. So patients with a 20-pack year history should be screened by CT annually from ages 50 to 80. And if they quit smoking more than 15 years ago, they could stop the screening. AAA, abdominal aortic aneurysm screening. All men above 65 who have ever smoked, in some formulations you may see 100 cigarettes, or who have a family history of AAA, we screen with ultrasound. I just wrote a note over here that we repair it if it's bigger than 5 to 5.5 centimeters or that it starts to expand rapidly. That is, more than 0.5 centimeters over 6 months. Osteoporosis screening. Every woman at age 65 with DEXA scan gets osteoporosis screening. And I just wrote a note over here that bisphosphonates greatly reduce mortality in women with osteoporosis. And there's unclear data on screening for men for osteoporosis, and therefore we will not be tested on it. Depression screening, this is our last slide. The USPSTF recommends screening for major depressive disorder, MDD, in adolescents ages 12 to 18, and for depression in general in the adult population. Okay, I hope you enjoyed this video. Again, please leave your questions and comments, and take care.